Carpal tunnel syndrome is one of the most commonly diagnosed conditions in the hand. We see it all the time, primarily in people that use their hands for their labor or for work, but we really can see it in anybody, and it can affect even people that don't use their hands commonly for daily tasks. The most common symptoms are pain in the hand and wrist. You can get numbness and tingling in the fingers, and oftentimes dropping things or weakness in the thumbs. Carpal tunnel syndrome tends to occur in 3 different stages. The initial stage is called the mild stage. The middle stage is called the moderate stage, and then the last stage is called the severe stage. Typically, as you progress through these stages, the symptoms get worse, but a lot of times people have very significant symptoms even in the mild stage. Commonly, we were initially treating mild stage fairly conservatively with physical therapy and potentially some medications or some braces. We have now moved towards doing more interventions even for the mild stage, as we have found that people do tend to have better outcomes with further intervention earlier on. Typically, the historic way that we were treating carpal tunnel syndrome has been to cut down through the palm of the hand and cut the ligament that sits over top of the nerve that causes carpal tunnel syndrome. Those procedures have been very successful and relieved the symptoms. The common problem is that typically the scar formation in the palm can be very painful, and it takes quite a while for the skin of the palm to heal. Because of that, people are typically out of work for a long time and are incapacitated with their hand for quite a while. We have now had such advancements in medicine that we've developed a procedure where we can cut the carpal tunnel ligament without cutting through the palm of the skin. Instead, we make an incision in the wrist crease, which that skin heals a lot quicker, and there's a device that can be introduced down into the palm, cut the carpal tunnel ligament, and come right back out the wrist crease without cutting through the palm of the skin. When I think about the benefits of the carpal tunnel release procedure under ultrasound guidance, what comes to mind initially is the quick recovery time. Patients are typically getting back to work and their normal daily activities and things they love within days. They have immediate use of their hand, as the procedure only requires local anesthetic and the incision is smaller than a fingertip. Another aspect of the ultrasound guided carpal tunnel release that's beneficial over the traditional way carpal tunnel releases have been done is that because the incision is so small, there is very minimal to no scarring, and oftentimes patients can't even notice the incision more than a week or 2 past the surgery. When I think about why I got into this and why I started providing this service to the community with this ultrasound guided carpal tunnel release, it's because as I saw my patients coming in and starting to struggle with even normal daily things, brushing their teeth and combing their hair and buttoning shirts and cooking for their families. These are things that, getting people back quicker and getting them able to do those things quicker make a big difference in people's lives. And it brings me the most joy seeing the patients come back in and they're showing me how they can button their shirt with their hands now. They're showing me the sweater that they were able to finish knitting for their granddaughter. They're showing me pictures from their garden that they were able to go back to doing and doing it quickly. Those are the things that really remind me of why I do this and the benefits of this procedure. The nerve that causes carpal tunnel syndrome is called the median nerve. It runs straight up through the palm of the hand here, and it sits under a ligament that sits straight into the palm over top. That ligament gets fibrotic and stenosed or thickened and starts to press on that nerve, and that's what causes the symptoms going up and down the hand. Previous to the advent of ultrasound, to visualize that ligament, we had to cut down through the palm so we could see it, and then cut the ligament and then sew the palm back up. As we've made advancements in ultrasound, we are able to visualize through the skin with ultrasound without actually cutting through the palm. That's allowed us to develop this procedure where we make an incision prior to the palm skin in the wrist crease. The device is introduced into that incision and slides underneath that ligament sitting over top. We are able to visualize the median nerve on one side and then all the vasculature that we don't want to cut on the other side in real time, and then cut that ligament, and then the device comes right back out that incision. It's a very safe procedure because we're able to visualize all the anatomy in the palm in real time and make sure we don't cut the median nerve, which is the important nerve in the hand. I mentioned sports medicine and ultrasound procedures earlier. I really can't touch on enough how much advances we've made in medicine over the past number of years and how helpful ultrasound has been in my practice and for really all sports medicine practices coming up now. It allows us to visualize through the skin, and the machines we're using now are such high resolution. A lot of them you can see things better than even MRI. And that has really transformed the realm of sports medicine, and particularly the realm of minimally invasive procedures such that we do in the hand, that we're able to perform things that took large incisions before, now through very small incisions, and getting patients recovered much quicker. And that's really the most important part. When a patient sees me and we suspect that they have carpal tunnel syndrome, the typical progression is we talk about the symptoms in the office. I usually do a diagnostic ultrasound of the wrist to look at the median nerve, to look for the size, and also look at the anatomy in the wrist. I'm oftentimes sending my patients for a test called an EMG. That's a test that tests the nerves in the hand and the wrist and can determine exactly whether or not you have carpal tunnel syndrome or if there's some other process going on that could be confounding their symptoms. Following that, and if we do see that the patient has carpal tunnel syndrome, we discuss the stages, what to expect, and then we talk about the procedure and if they would like to move forward with that. Once we determine you're going to move forward with the procedure, typically we do the procedures either in a hospital or a surgery center. They're performed same day. The procedure is quite quick, and again, you're awake the whole time. It's just local anesthetic that we use that numbs the hand up. There's a very small incision made in the wrist crease. The device is inserted into that incision. The transverse carpal ligament that causes the carpal tunnel syndrome is then cut. The device is taken back out that incision. The incision is so small, as we discussed, you don't even need stitches. You typically just have some steri strips, which are essentially medical band-aids covering their incision. After that, you have full use of the hand. Typically the hand is numb for that day from the lidocaine. Typically the lidocaine wears off in about 24 hours or so and the hand feels fairly normal. We have you ice the hand, but you can use it however you want to, and really the only restrictions are we have you not get the hand wet for a couple days. I tend to see you back in the office, typically doing the procedures on Mondays and see you back in the office on Thursday or Friday. We remove all the bandages and you have no restrictions after that. And really when I talk to my patients about why this procedure is so beneficial over the other options that are available is you have immediate use of your hand that same day. You can leave the hospital or the surgery center and go and use your hand immediately, and a lot of patients can even drive themselves home. Their recovery time is really impressive. Honestly, I've had patients go back to work that same day. I've had patients go back to lifting the next day. It's very impressive. I tend to ask that you limit the use of it as far as doing things extremely strenuous for a couple days, but really you can get back to doing things really quickly. And lastly, it's scarring. That incision is so small, so much smaller than the other incisions typically made to handle this problem. The scarring is minimal, and typically people can't even find where their scar was after a couple weeks of the procedure. This procedure has been around for a long time. What has gotten better and what has been exciting is all the advancements we've made. Advancements in technology with higher resolution ultrasound images, advancements in the devices that we use to perform the procedure. Those advancements have led to better safety for patients and honestly faster recovery times. With those advancements, I really believe that ultrasound guided carpal tunnel release will be the standard of care.